We like to start this talk on women's health typically over a cup of tea. We've tried to make it a lot more interactive than some of the other talks that we have. We'll commonly start this talk by asking women what they really would like to learn. Common things that they bring up is PMS, hormone replacement therapy. Recently we were just asked about leaky gut and how that affects women's health. So we'll cover those as we go along here. So grab a cup of tea, pull up a chair, and relax. We'll start this talk by looking at the difference the way men and women view themselves. For some women, for some reason, when women look in a mirror, they see something a whole bunch larger than what they actually are, and men, for some reason, can see something a whole bunch more lean and attractive than what's really there. Don't really know why that's the case, but it seems to be a very common perception. If we start to look at the anatomy of women, we're going to see something that's very interesting here. This is a typical view looking from the front side, where we see the uterus, the fallopian tubes, the ovaries, and the round ligament basically holds everything in place. If we turn it to the side, we start to see the same anatomy, but we'll do something different with this. If a fetus was going to become a male at about 7 weeks after conception, it'll get a small shot of testosterone. If that happens, the developing uterus will drop down, wrap around the base of the urethra, and become the prostate gland. The ovaries will drop down through the inguinal canal into the labia, dragging with it the round ligament. The ovary becomes the male testicle. The labia drop down, become the men's scrotum. The seam on the bottom of that is where the labia is sealed together, and the round ligament becomes a spermatic cord. The clitoris elongates, wraps around the urethra to become the penis. And so you can see we're basically made from the same thing. And the reason I bring this up is all of the issues that women have, all of the problems they have with all of their tissues, men have the same problems. Usually it's the same hormonal dysfunctions that cause those. In reality, even though the subject is women's health, we're covering both aspects, both men and women's health, at the same time. Men usually just don't talk about these things. So if we start, we'll look at the typical estrogens that a woman creates. She typically has 3 primary ones. The most common one in menopause is estrone. It's labeled as E1, and it basically causes a fire in all of her tissues. It'll cause cancer, breast changes, fibrocystic issues, fluid retention, cramps, all the things a woman doesn't want to have. Estradiol is the one that's more prevalent when she's cycling. It's a calming hormone, nurturing the tissues to grow like they normally should. It'll help the uterus and the breast to grow, normalize the secretion she has, her cycles. It's still present in menopause, but it's at a low and constant level. Then there's estriol. That's the primary, the pregnancy hormone. It's produced by the placenta. It nurtures the infant and all the changes that a woman needs when she's pregnant. This usually can be measured in the urine about the 9th week of pregnancy. So we recap that. Estrone, E1, is a menopausal hormone causing fire. Estradiol, E2, is a normal cycling hormone, nurturing all the tissues and making them healthy. Estriol is the pregnancy hormone, labeled as E3. When you compare that to Premarin is primarily from collected pregnant horse urine. They extract the estrogens out of it. The estrone in Premarin is 75 to 80%. Equilin, which is a foreign horse estrogen that's toxic to women, 6 to 15%. Estradiol and 2 other horse estrogens are 5 to 19%. And horse estrogens are always very toxic to women. If we take a look at this chart, this gives us the effects of estrogen. The top part on the left side is the estrone effects. These are the fibrocystic issues, the weight gain, the fluid retention, depression, anxiety, headaches, migraines, interferes with thyroid hormones, libido, all of the things that women don't like. The bottom group is more common with the estradiol. It helps the uterus to grow the way it's supposed to, relieves hot flashes, keeps the normal fluids flowing so she doesn't have the dryness problems she has commonly in menopause. Improves memory, bone health, all of the things she likes. And progesterone, on the other hand, is what balances everything out and presents all of the major problems that women have. Some of the problem that women do have when they're cycling, they're having all of the retention issues and all that, is they don't ovulate and they don't produce progesterone. When they don't produce progesterone, nothing ever balances, and they just stay in inflammatory fire all the time. This is typically how the body controls its hormones. It's called a negative feedback loop, and this is how women's hormones function. The hypothalamus reads how much hormones we have. It communicates with the pituitary. In the case of a women's cycle, the pituitary will produce a hormone called FSH, which is follicle stimulating hormone. That has a target in the ovary. All the eggs in the ovary have a bunch of cells that surround it, and that make up what's called an ovarian follicle. The FSH helps the ovarian follicles start to mature, and as they mature, they start to produce estrogen. The more they mature, the more estrogen they produce. The estrogen is read by the hypothalamus. When it gets high enough, it will release another hormone called LH, which is a luteinizing hormone that says to ovulate. It'll take the most ripe of the maturing follicles and cause it to burst open. That's called ovulation. The fallopian tube should catch that. What's left of the maturing follicle becomes what's called the corpus luteum. The corpus luteum produces progesterone. Progesterone gets a woman ready to get pregnant. It also balances off the effects of the estrogen hormones, and if she doesn't get pregnant, the whole thing degenerates. She has her cyclical flow, and the whole thing starts up again. This is a typical view of what it looks like in the lining of the uterus, how it grows along with the hormones you see down below. The FSH comes in on the far left. As it starts to produce the follicle, the lining of the uterus starts to develop. As it gets quite developed and the follicles gets real mature, the estrogens peak, luteinizing hormone is released. The lining of the uterus continues to grow as the progesterone starts produced by the corpus luteum, and if there's no pregnancy, then menstruation and the slough-off occurs later. Well, hormone balance is controlled by these several factors. The food that we eat, it determines how much inflammation and toxins we have. The gut, and gut health controls our hormones, our nerves, the inflammatory and toxic load of the body. The liver is a detox organ. It also controls blood sugar and stores food. The brain gives us our hormone regulation, although a fair amount of that is actually controlled in the gut. The thyroid gives us energy and 50% of the menstrual cycle. The adrenals, they give hormones, sugar, they control blood sugar, and they control swelling. And the ovaries produce estrogen and progesterone. So with that, we can take a rest as we prepare to just dive into really what makes all this work. It really starts right here with our choices. However we're going to treat our gut is going to determine how our hormonal function works. If she chooses that which is on our right, the chocolate, is going to create inflammatory nightmares and hormonal imbalances. If she chooses what's on the left, it'll allow her hormones to normalize, no inflammatory issues, and her cycles will be fairly insignificant. This shows some of the research to prove that our hormones actually start in the gut, and from the gut hormones it affects the hormonal health throughout the rest of the body. The gut also has a nervous system. It's called the enteric brain. Some of the research out there has been raising the question for a while: are there more nerve connections in the gut than there are in the brain? The question wouldn't be there if people didn't realize, or the researchers didn't realize, how extensive the nervous system is in the gut. It's quite huge. Along with that, we have the physical health of the gut. This is looking at what's called the microvilli, the absorptive surface of our gut. And typically on the far left is what it should look like when it's really healthy. When we start to have inflammatory changes, we get the black spots starting to show up. The microvilli start to change in their shape and size. Eventually they'll atrophy, and we'll have a severe case of leaky gut. This is one of the main causes of the leaky gut, and that's called Candida. Candida typically has 4 forms. There's a yeast, a mold, a fungus, and a fungal parasite. This right here is going to be some of the fungal forms and fungal parasite forms shown right here, where it's actually embedding into the wall of the intestine and creating all kinds of toxic issues here. This is a microscope slide of intestinal health. On the left side is a normal intestine. On the right side is one with chronic inflammatory issues, where the fingers sticking up, called the microvilli on the left side, are all wasting away and disappearing on the right with the inflammatory condition. This is the fungal form of Candida right here, the soft feathery looking stuff. Those are called mycelia. Mycelia are actually the feeding tubules of the fungus itself. The problem with this is the outside of the feeding tubules is made of chitin. Chitin is the same thing that makes a hard shell on bugs. And when the mycelia start to penetrate into your gut wall, it's like the legs of this bug right here are penetrating through your gut wall. It's like having thousands of these throughout your gut. It wreaks havoc and makes the gut leak, causes all kinds of inflammatory problems. This is an electron micrograph picture of the lining of the gut with chronic inflammatory issues. And you can see it literally blows holes right in the surface. The surface layer of the gut is only 1 cell thick, so there's not a lot there to protect it. And when there's chronic inflammatory issues, that surface just starts to break apart. That allows whole proteins to get into the blood. It'll allow some of the bacteria from the gut to get into the blood, pathogenic or otherwise. Overloads the liver and creates a lot of problems. Candida also produces acetaldehyde. The problem with acetaldehyde, it's a really bad toxin. It will start to kill all the nerve cells that make dopamine. A significant amount of the dopamine, maybe 50% of the dopamine we make in our body, is made in the gut. Well, the reason why that's important, dopamine is your feel-good hormone. So if you start killing the nerve cells that make dopamine, you're not going to be able to feel good at all. Along with that, we start to have a leaky brain. The bacterial walls are made up of what's called LPS. That's lipopolysaccharide, for those that really need to know. And those will start to, some of those fragments of lipopolysaccharides will start to come through the leaky gut. Once they start to come through the leaky gut, the liver can't catch them because it's too overwhelmed. They start to circulate, and that'll create a leaky brain also. The leaky brain will start to give you a foggy head, different kinds of plaquing, and be the foundation for a lot of degenerative and psychological problems within the brain itself. Here's a picture of how the whole gut works, and if we look at this, all the purple cords right here, that's the returning veins coming off the gut. Notice they all go straight into the liver. We were designed that way so the liver could do an extensive amount of the job that it has. Its job is to catch and destroy the bacteria and pathogens that come through the gut, to store your food sources, make sugar from your protein when the adrenals are stressed and pumping out cortisol. It's also, the liver is also supposed to clear the body of toxins and make bile. Well, when the liver is overwhelmed with toxins and too much pathogenic issues, it starts to create an inflammatory issue, and that's when the adrenals kick in. The adrenals are designed to have us defend our lives. We're either going to fight to defend our lives or run to defend our lives. When the adrenal is burnt out or chronically stressed and producing too much cortisol, this type of body shape it will produce. The cortisol makes the muscles liberate their proteins. Those get converted into the liver and into sugar. The sugar makes insulin levels rise and tries to get the sugar out of the blood. Well, the most common place for that to go is back into the abdomen. There it starts to deposit fat and makes a thicker thorax like this. The typical common look of somebody with adrenal burnout is bird-like legs. Same type of arms can be there, sagging, hanging, loose abdomen like this, and in this case you start to see a bit of man boobs growing because of hormonal changes that we'll get to in a little bit. In postmenopausal women, all estrogens and nearly all the androgenic hormones are made locally from adrenal hormone called DHEA. In adult men, about 50% androgens are made locally by the same mechanism. And believe it or not, in normal cycling women, this is still a significant amount of her estrogen production is going to occur from the same way. Her ovaries will produce a little bit more estradiol when she's cycling. One of the problems with us getting hormones from this way is chronic stress. If you look at this coming from the top, 2 levels down, you see DHEA coming off the adrenals. That drops down and makes the hormones that make women women and men men, the estrogens and the testosterone. When we're chronically stressed, we don't make the DHEA. It gets stolen. It's called the pregnenolone steal. It gets stolen, goes over to the other side to produce cortisol or cortisone to help decrease the inflammatory response that's going on. Well, when we add this to that, we start to see that the estrogens are produced mainly in fatty tissue. And the cortisol that comes from the adrenal production of chronic stress will turn the cells on to turn the fat cells on to start to change the hormones. in the fatty tissues, whether this is in the breast, in the abdomen, wherever, the cortisol and the rising blood sugar will turn on a hormone called aromatase. Aromatase will make your normal circulating estradiol turn into estrone. It takes men's testosterone, turns it into estrogens. And normally progesterone will inhibit all of this, but if this gets to be too much, she won't cycle, won't produce the progesterone, and then she has problems. So here we see this in action. This is somebody eating a diet that will stress out the adrenal glands. Typically, our standard American diet will do that. That's high fat, high digestible carb type of a diet will stress the adrenals out. They will continue to produce cortisol to try and deal with the inflammatory response that does. That'll make us start to deposit all the extra weight in the abdomen. Then the hormone aromatase will be excited by the rising blood sugar along with the cortisol. The aromatase then changes the hormones, the estradiol into estrone and the testosterone into estrogens. Here's a cover article in Time magazine coming off a research article, The Secret Killer Being Inflammation. Well, one of the biggest issues of inflammation within a woman is too much estrone. When her aromatase activity kicks up, she converts her normal healthy estrogen, estradiol, into the estrone. When we look at the major cause of inflammation, this is one of the bigger issues, and this will cause inflammation in every tissue and organ in a woman's body. Progesterone always inhibits the cortisol, and it starts to normalize all the effects of toxic estrogen issues. One of the biggest things is to try and get a woman so that she ovulates so her progesterone can normalize those things. Here is a view of negative feedback of the thyroid function. Typically we see the same thing that we saw with the estrogens and the ovaries. The hypothalamus reads the circulating thyroid hormones. It communicates with the pituitary. The pituitary then produces TSH, the thyroid stimulating hormone. Its target is the thyroid. The thyroid produces thyroxine. The thyroxine is converted in the liver and the kidneys into T4, T3, T2, and T1. Those can be regular or reversed, and the problem with the reverse is biologically inactive. One time we had a woman, finally after a year, got a more complete thyroid test panel done on her, and her reversed T3 was almost 200 times what a regular was. So the hypothalamus thought she was doing fine, but the body said nothing's working, and she was quite out of balance. Problem with the thyroid is 50 or 75% of thyroid problems are actually autoimmune from too much toxins, and the too much toxins come from the leaky gut issues we were looking at. The hypothyroid absolutely affects the menstrual cycles. You can see here about 35% is either infrequent or no periods at all. It depresses the ovulation. Without ovulation, you can't have the balance of the progesterone, and the autoimmune issues with the thyroid, 44% of those have endometriosis, 27% have polycystic ovarian syndrome. This is typically what someone looks like with the chronic thyroid issues, lumpy, bumpy weight everywhere, and the clothes just don't fit anymore. Hyperthyroid really isn't any better. 65% of the people with this have menstrual irregularities. Metabolism of estrogen is altered. increased conversion into masculine issues, and autoimmune issues is 5 times higher in women than it is in men. This is a typical look of a hyperthyroid. There's a fat that deposits behind the eyes and starts to push them out. They get bulgy like this, and they're always bloodshot. Well, 1 in 10 women have polycystic ovarian syndrome. It's one of the more leading causes of infertility, and the causes for this are fairly simple. Most realize that blood sugar has something to do with it, but the reason why the blood sugar is there is typically because the standard American diet is driving the adrenal to make cortisol. The cortisol makes the muscles liberate their proteins to raise the blood sugar. Along with that, we have the insulin has to rise to try and get the blood sugars to be normalized, and then the thyroid comes in with that also. With a depressed thyroid, nothing works right, and it's typically that is the perfect storm of blood sugar rising, creating more insulin, with aromatase activity, going to convert hormones, thyroid depression, and we add to that some of the toxic estrogens that are in there. Bisphenol A, one of the common additives into plastics, is one of the biggest issues. That's what the xenoestrogens are. Or the conversion of your normal circulating estrogens by aromatase into foreign estrogens, that will do it also. Those are the factors that cause the PCOS. When we look at Hashimoto's, Hashimoto's thyroiditis gives no reason why it's happening. It's just a response that Dr. Hashimoto noted and was made famous by. Threefold incidence of autoimmune issues with these people. PCOS is absolutely related to it. And as I said earlier, 75% of thyroid problems are from autoimmune disorders. That's typically from too much toxins. You can link that all back to the leaky gut, which is everything to do with our poor American diet. So this is looking more at a graph issue of what causes the PCOS. We got weight gain, which causes insulin resistance. That gives increased insulin, decreased serum hormone binding globulin, increased testosterone. All that leads to infertility. Here's a common medical way to treat something like PCOS. They gave the mother some drugs to try and make her fertile. And though this is fruitful, one of the sadder things, if you look at the faces of these children, most of the ones in the stroller look like they are Down's children. And the incidence of genetic effects, trying to push something pharmaceutically when you have a major problem going on, can create some real nightmares. Even though children are a blessing, we don't need to force them into this type of a thing. Research has long been telling us that the autoimmune process can be arrested if we treat the gut health and reestablish the things that need to be established in there. This shows the hormone estradiol stimulates cell growth, and there's something with this cell, with this slide. The estradiol typically creates more of a healthy growth than the estrone that creates the unhealthy growth. Typically the estrone is going to just make the tissues grow without restraint, where the estradiol will make them grow in a normal, healthy, cyclical way. If we look at Premarin, one of the common ways that women try and deal with the declining hormones in menopause, Here's a study that shows the health risks of long-term use of combination therapy, the hormone therapy, clearly outweigh the benefits. They actually did 2 studies, and they had to ethically quit the studies because women were starting to develop all the things they were trying to inhibit from giving the hormonal therapy. So we look again, our normal estrogens, estrone, E1, the menopausal estrogen, estradiol, the cycling, and the estriol, the pregnancy one. The Premarin, 75 to 80% estrone, which causes fire in all the tissues. Equilin, which is a horse estrogen, is highly inflammatory and highly reactive, 6 to 15%, creating fire in all your tissues. The estradiol and 2 other horse estrogens are 5 to 19%. Most of this is just going to create a fire in all of your tissues. The FDA recommends that hormone therapy never be used to prevent the things that women are told that it's supposed to prevent, and when it is used, it should be done at the smallest dose for the shortest time possible. The conversion of the normal hormones into estrone increases with age and obesity. The obesity is a real important issue because how we eat determines that, as we've seen from the thyroid and adrenal issues and what it creates. Estrase, another hormone replacement, is ethinyl estradiol. It's 100 times more potent than a woman's normal estradiol. It creates inflammatory fires that can lead to cancerous and precancerous issues like this. Premarin warning label. Estrogens should not be used for the prevention of cardiovascular disease or dementia, and it increases the risk of heart attack, stroke, invasive breast cancer, and a whole bunch of other things that nobody really wants to ever have. This is what you need to know if you're going to try and chase down all of the issues of estrogen metabolism, or we can take a simpler approach. If we have a much healthier diet, vegetarian women, they excrete 3 times more estrogen than meat eaters, and it reduces a whole bunch of our estrogen issues. If we just push our diet toward more vegetarian issues, we'll fare a lot better. 4 to 13 servings of fruits and vegetables help normalize all of the needs that we need inside. And it's a combination of the phytochemicals, all the things that have the different colors, are far more effective than isolated compounds. So the rule of thumb is to eat at least several servings of at least 5 different colors of vegetables a day, and you pretty well can have all that covered. So for hormone balance, this is what we need to look at. We need to look at our food because it creates inflammation and toxins. The gut, it controls the hormones, nerves, inflammation, and toxins. The liver for detox, blood sugar, and hormonal regulation also. The brain for hormonal regulation. The thyroid for energy, 50% of the woman's cycle. The adrenals for hormones, blood sugar, swelling. And the ovaries for estrogen,